You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, Dr. Major. Dr. Major, welcome to the program.
Thank you. It's a pleasure to be here, Randy.
Now, for people that don't know you, I guess you've lived your whole life in Chattanooga.
Yes,
Is that
I have.
right? And you must know most of your patients. But for people that don't know you, who's your typical patient and what are the different services you offer? Because you kind of have this all under one roof thing that you do.
Yeah, we don't really have a typical patient. We see children, adults, older people, and we do all sorts of different types of procedures. We do cleanings, we treat gum disease, we do fillings, root canals, crowns, bridges. Bridges replace missing teeth. We do Invisalign to get smiles straightened out.
Is that popular, by the way? Invisalign?
Invisalign is very popular.
A lot of adults?
Mostly adults enjoying the services of Invisalign because you don't see braces, you don't see brackets, and it's a very nice procedure.
Okay.
We also treat sleep apnea. A lot of people with sleep apnea are hooked to a CPAP machine, which has a hose, and it's very uncomfortable.
You say they hate that.
Oh, they really hate that. It works well, but it's uncomfortable for most people. So we have an alternative, and we make a mandibular advancement appliance, which is something that you wear in your mouth that moves the jaw forward while you're sleeping and allows you to breathe more naturally.
Does it work, though? Are there people getting off CPAP?
Yes, a lot of people are getting off CPAP. It's so much more comfortable, and if you travel, it's even better because then you don't have to carry a CPAP, especially if you're going through airports and carrying it on trains. A dental appliance is very small, and you can even put it in your pocket and take it with you.
Okay. Sedation. Because people don't like going to the dentist, and you do a lot of sedation.
We do a lot of sedation. We see a lot of people in our practice that are nervous about having dental work done. They may have had some bad experiences, or they may want to have a lot done in a single visit, and sedation is just an ideal way to make them a lot more comfortable. We do both oral sedation and IV sedation.
We've invited you on the program to talk about dental implants. Mm-hmm. Are most of those people that are getting this done have some sort of sedation?
I'd say over half of them are having sedation, and the patients that do this really like the sedation. They come in, they have the procedure done. A lot of times they don't even remember the procedure.
They don't?
No, that's the nice thing about the sedatives that we use. They don't remember the procedure, and sometimes they get home and they wonder, have they actually been to the dentist? That doesn't happen often,
because
but it does
they're getting
happen.
a ride. I guess they're getting a ride home.
Oh,
and
yeah.
they forget, like an amnesia effect?
Yeah, there's an amnesia effect with the sedatives that we use, and that makes everything so much more pleasant, especially if you're a nervous patient or you're having a lot of things done.
All right, so now, dental implants,
Mm-hmm.
replacing missing teeth. At the top of the show, we said no more dentures. Mm-hmm. You believe that, or elaborate on that?
I think a lot of people out there would benefit from dental implants. When you have a denture and you're trying to eat or out in public, the dentures are moving around, and it makes it very difficult for you to be yourself. If you've got something that will hold your dentures in place, like dental implants, then that's going to change how you react to other people, how you eat, just your comfort, your confidence. It'll change your life.
So are there a lot of people wearing dentures where you are in Chattanooga?
Yes, there's a lot of people in Chattanooga. I'd say there's probably 20, 30, maybe 40,000 people who have
Is that
denture.
right?
Oh, yes. And dentures are just way too common out there. And, when people lose their teeth, it just makes it so difficult for them. We like to find a way to change their lives, make them more comfortable, and give them some security. And
okay. Now we've talked a little bit about this, but you say with just 2 implants, you could give them a full set of teeth that snap on, like anchored in, that no more adhesive.
That's exactly right.
And they can eat?
Oh, absolutely. And they can eat just about anything. Of course, the more implants that you have, the more stable your teeth will be. And we can even get to the point where we can make your teeth actually stay in there permanently. And
with dental implants, so like a full arch of teeth?
full arch of teeth and they never have to take them out, or you can have the types that do come in and out.
You say there's tens of thousands, or you said 30,000 people in Chattanooga with an upper lower denture, I think you said. If it's so good that they could come in and get something anchored in with dental implants, why aren't they all doing it? What's your take?
Well, I would say that most of the people that have dentures stopped going to the dentist. They don't have teeth, so they feel like they don't need to go. So they probably don't know what's available. They don't know their options. And frankly, there's some great options out there. And another reason they're not doing that is they've had a lot of bad experiences. They had gums that were bleeding and they've had to have dental work done, teeth that were failing, gums are failing, root canals failing. And once they have the teeth removed, in some ways it's a relief that they don't have to deal with that problem anymore. So they just don't want to go back to the dentist.
Do you hear that where people come in and say, no offense, doctor, but I don't like coming to the dentist? I mean, is that part of what you have to hear all the time?
I hear that every day. And
do you have a good comeback for that?
I really don't, because I can't blame them if they've been through a lot of troubled experiences through their years. But there are good things that we can do to help them and get some more stability back in their life.
But it does seem very painful to get a dental implant placed in your mouth.
It really isn't. Removing a tooth is much more painful than having an implant, because there's no nerves actually in the bone. The gum is where you might have a little bit of discomfort. But once the implant is in there, you don't even know what's in there anymore, because that bone heals around it and it's solid as a rock. There's a lady that was in my neighborhood that when I was growing up, and she came to me and her teeth were failing. Her teeth were mobile, she had some breath issues, and she was very frustrated by that. And we came up with a plan to put some implants in, and we removed her teeth, put her implants in, got her some dentures that were snapped onto those implants, and she says it's one of the best things that she ever did. She was really glad that she did come see us, and I was very, very happy to help her. Back to your original question about pain, she never had the first problem with pain. It's just one of those great cases that we see very typically, that there just isn't that much discomfort with placing the implants.
Okay, how old can you be, by the way, to get a dental implant? Because you say that, and obviously there's going to be denture wearers watching this, so how old can you be?
You can be any age. All we need to have is someone who wants some more stability in their mouth, and we can get some implants in there. I've treated patients way up into their 80s with implants.
Is that right?
Yeah. Then people say to me all the time, either I'm too young for implants or I'm too old for implants. And the real answer to that is, if you want them and you need them, you should consider having them.
So are they more, statistically, are they more likely to fall out if you're 85 years old?
No, the bone was going to heal very well around implants. Age really doesn't come into being a factor. It's more your ability and your desire to be able to eat comfortably, enjoy life more.
But isn't it true if you've been wearing dentures for like 30 years, your bone dissolves and you don't have enough bone for dental implants?
I work with oral surgeons and periodontists if we have a real unique case, but there's always something that we can do to get implants in there. So there's just so many great cases out there, that great ways to help patients who really need implants, really want implants.
On the consult, somebody comes in to see you. What are the questions they have? Like somebody wearing false teeth. What do they want to know every time?
The first thing is, am I a candidate for implants? And again, like we said, virtually everybody is a candidate. They want to know, is it painful? And I think we've already talked about that. Placing implants is really not a painful
Why? Because the
procedure.
bone doesn't really, there's not really feeling in the bone.
Yeah, there's no nerves in the bone, just a little bit in the gum. So once that's in place, patients really have very little discomfort with the implants. They also want to know, how long does it take before they will have their dentures in there that will snap in, and sometimes it's very quick, matter of days, and other times it's a little bit longer than that. but we will evaluate each and every case and give you what we feel is the best treatment option for a successful result.
Okay, now you've been in and around dental implants for how long now?
I actually placed my first implant back in the late 1980s, and I've been doing a lot of implants in the last 7 or 8 years.
You know, and correct me if I'm wrong, I think we talked on the phone and you said your goal is to just do more and more and focus on dental implants.
Yes.
Is that right? Why is that?
Well, frankly, that's an area of need in this country. The people all around are not able to eat well. They just don't have the confidence in life, and it's just so rewarding to see the way that we can turn people's lives around.
Now, what about the crowd of people that are trying, because you say that are trying to avoid false teeth? They don't want dentures, right? Maybe their parents or whatever. What about their gums? Because these people have bad gums. Are they not candidates?
No, they're still candidates for implants, because when you have bad gums, it's caused by the bacterial infection that exists on the roots of their teeth. And if we remove the source of the infection, the tooth with the bacteria on it, then the gum and the bone will heal real well, and that's a great place to put an implant. So we can put a single implant in and replace a single missing tooth. We can put a couple of implants in and put a bridge on 2 implants, or we can place implants around the mouth and have dentures or teeth that will snap into them or screw into them. Let me give you an example of this young lady that came in to see me. She lost her teeth when she was 25 years old, and the bone continued to go away year after year, and she was about 36, 37 when she came to see me, and her dentures just wouldn't stay in her mouth.
Is that common, by the way, somebody that young with dentures?
More common than you would hope, but there are a lot of people out there in their 20s losing their teeth.
Okay.
And this lady said, "Is there anything I can do?" Because she'd wake up with her denture in her bed, and
wow.
She felt that was kind of it was very much an embarrassing situation for her. So we took a look, and we placed 4 implants on the lower. We placed 6 on the upper. We gave her teeth that just snapped in on the lower, and on the upper we restored her smile. Her smile just shines now, and we've just had such a great time with her, because every time she comes in, her personality has just blossomed. She's just become one of our favorite patients all the time, but her life has just changed because of the implants and the confidence that she now has.
So you make dentures in your practice, is that right?
I've made hundreds of dentures, probably 1,000 dentures.
1,000 dentures?
Probably. And
but you don't like dentures?
I don't like dentures. They just, it's just not a great treatment. And what I've found is that if I knew then what I know now, I would have recommended implants and pushed my patients more towards doing some implants, because it'll be so much more comfortable for them.
So they're watching, let's just say they're flipping through channels and they see you, right? And they're wearing a denture. They go, "Oh, there's my doctor that made my denture." What do you want them to know?
I want them to know if I could get them just 2 implants in here, I can possibly even use their denture and get it to snap in and give them such a solid bite that it will change their life. It'd be even better if we can get 4 implants in there. But I think that would just help so many more people.
So insurance does not cover this in the U.S., is that right? Dental implants, Medicare doesn't cover it?
Unfortunately, insurance doesn't cover implants. It would be very rare for them to cover that. But we've got ways to help patients get the implants that they need and want. We have financing plans. There's all sorts of different ways to help our patients get the implants.
So there's a lot of people with dentures, and you say no more dentures. Is this the future of dentistry, where all dentures will be snapped in to something?
I certainly hope so. The difference between 2 implants and no implants is just huge. So I'm going to ask all my patients, offer all my patients the opportunity for implants every time in the future.
So is your goal to just kind of wipe out in Chattanooga, no more dentures?
Randy, that's what I'd love to do. People that don't have the implants just don't know what they're missing. If I could give people a chance to try implants, if I could just put them in and
like a
let them
test
try,
drive on
like
a
test
weekend.
drive, yeah, just like you could with a car, that would be terrific. Unfortunately, we can't do that, but they would absolutely not go back to a denture without implants. I've never had a patient who regretted doing implants.
Now I know if you, at least a couple denture wearers, right? They're wearing false teeth. They never complain.
Well,
I mean, they seem to be happy with their denture.
Well, Randy, you're not a dentist. They're not going to complain to you, but they sure are going to complain to me. And you know, when they first get their dentures, they've got to get used to them. They've got to get used to the fact that the roof of the mouth is covered. They don't taste their food as well. They gag. The lower denture moves all around. And over time, they do adapt to it. It does occur over time that they can get used to it. But are they really happy? And I'm just not sure that they're really happy.
You think they've just adapted?
I think that's basically what it is. And
so it's their fear then. They're just, I guess, their fear of the dentist.
well, it could be fear.
But you say it doesn't really hurt, right?
Right.
Pain is not a problem.
Right.
And during the procedure, they feel nothing.
That's correct.
Okay, so there's no excuses.
There's
Not in your practice, right?
There's no excuses to not come in and find out what your options are.
So if everything goes right, and they're watching this, and they have a denture, how soon could they get their maybe even fixed set of teeth, or something that snaps in, snaps out?
I'd say 8 weeks is the minimum amount of time. Some cases take a little bit longer.
Are they ever without teeth?
No, they're never without teeth. They will have teeth from the day that they have their natural teeth removed until, well, from that point on.
Now you brought some models right there. What are we looking at?
Randy, this is a model of a removable partial denture, and this is very standard dentistry.
Tilt that a little bit. Let me see that in the camera. Okay. And so that's typical. They lose their teeth in the back?
That is correct. And what you can see here is the bone is going away. You can see how it's dipped down there?
Yeah.
That's because there aren't teeth back there. As time goes on, that bone goes away. And when you have a removable partial, it's putting pressure on that bone, and that forces it to go away. And you can also see where it has these metal clasps, and these clasps right here will grab hold of those teeth. And because the bone is going away, the partial actually starts to rock, and it will loosen these teeth over time. So as time goes on, you'll lose more and more teeth because of a removable partial. Now we can solve this problem by placing dental implants back here that will then go into the bone, and it'll preserve the remaining bone that's in there, and you can have teeth that are in there permanently instead of having something that you take in and out of your mouth.
And you do that now in your office?
We do that right now in our office.
Now, how long does something like that removable thing last over a dental implant supported, I guess, locked in bridge? Is that
Over
what
a
you call it?
bridge, yeah. A partial probably should be replaced between every 5 to 10 years because the tissue's changing, and it needs to be readapted so that it stays comfortable and doesn't do damage. A bridge on implants can last you the rest of your life. So a huge difference in the length of time. So over time, implants may actually be less expensive than a partial.
And it doesn't really hurt. It seems like it would hurt, though.
It really doesn't.
Because the bone just doesn't
have any nerves in it. And here I have an example of a lower implant denture. And this denture, if I can get it off here,
Okay.
has 4 implants.
So that's a lower jaw.
This
right
is the
there.
lower jaw right here.
Okay.
And this is an implant denture, and these are implant abutments right here.
All right.
An abutment is what the denture snaps into. So
So let me see those snaps at the bottom. Kind of point them toward me for the camera to see. So you can use their existing denture to make those little fastens right there.
many times I can use their existing denture, but also if you've got an older denture, it's not going to be as cosmetic. It's not going to give you as nice a smile as an older denture would. So typically we do make a new denture.
And then it just snaps right on.
And then it snaps right into place.
Let me take a look at this, because you look like you were exaggerating when you were pulling this off. So it's this snug. This is like a real...
That's
Okay. Okay. So it just snaps right off.
Snaps.
Now this is 4 implants.
This is 4. We can do two.
You can do just 2 right there
Yeah, we can do
at
4.
the front.
Yes.
But this is 4. Let me hear this. So it just snaps right on.
Snaps right in.
But what if you have a little bit of arthritis? I mean, that would be very tough to take out.
Well, we have different types of snaps that we can put in here. So we can put looser snaps in, and it makes it easier to take it in and out. We want to make it as tight as it is easy enough. We want to make it tight, but we want to make it easy for you to take it in and out.
So how soon? Okay, so when it's all done, they've done the surgical procedure, they've healed. How soon can they eat?
They can eat that night.
Is that right?
Yeah. And what we want them to do is go home and start with some soft, easy foods just to get used to it. And then each day they can start trying some foods that are a little bit harder to chew. But within a week or so, they ought to be able to go out and eat just about anything that they would like.
So they could tear through like a steak or what about an apple, things like that?
They can eat an apple. Actually, salads, raw vegetables are some of the hardest things to chew with dentures, because the way a denture works is it's more an up and down motion versus how we normally chew with natural teeth, which is more of a rotational movement. So with dental implants, you can go back to a more natural chewing method, and you can chew just about anything.
So it's probably a healthier diet. So they're not just eating a bunch of soft, maybe high carbohydrate food. They could get some more protein or fiber, I guess.
They can get all of that. Plus, the first step of digestion is chewing. And if you've got dentures working about 5% that of natural teeth. In other words, they just don't work real well. So you're not chewing your food as well. Or it takes a long time. You know, how many denture wearers are the last person to finish eating a meal?
I don't know.
It's most of them.
Is that right? That's
yeah.
a good point. So it takes them a long time because they're just kind of rubbing the food together?
They're rubbing the food together and doing the best they can to break it up. But when you've got implants, then that's not a problem anymore.
You say it transforms people's lives.
Yes.
What do you mean by that when you say that?
Well, it changes so many things. It gives you the confidence to go out in public. Again, we talk about you're the last person to finish eating. You go to a restaurant, everyone else is finished and ready to go, and you're still there eating. You know, that bothers you. If you play sports, run, play tennis, could you imagine if you were having to yell to hit your overhead and your denture flies out?
So these are legitimate fears that people worry about them falling out?
Absolutely.
Is that right?
People change their lives so that they don't embarrass themselves. And
So they hold back a little bit.
yeah, they hold back in many different ways. A very interesting story that I have about a gentleman that had gone through a divorce. He was thinking, you know, I need to do something to get back into the swing of things, and I wanted to start dating. So what he did was, first thing, went out and got some implants done. He had implants on the top, on the lower. He got some teeth fixed, and his smile was great again. And last I heard, he's out there dating again.
Because he has his smile back.
Yeah, and he's 62 years old. So
And that's young.
yeah.
So nobody should be without teeth, or nobody should be wearing a denture at any age. I mean, is that your position?
That's the way I want it to be. That's our goal, is to try to get everyone out there to get some implants and start enjoying life, get some confidence back.
Chattanooga, I mean, you guys are also known for your music, things like that. Musicians with dentures. Is it difficult for them to sing? I mean, do you hear complaints there?
I do. You know, you've heard stories about professional singers, like, for example, Barbra Streisand was always asked why she never had her nose changed, and she said she was afraid that it was going to change the quality of her voice, and that's an unknown quantity. But you know, when you have dentures, I mean, that changes how you speak.
So they're worried that it's going to change their voice.
They're worried it's going to change.
Have you
the
found
voice.
that to be the case?
I have seen that in some cases where people say words that they just can't get out because their tongue hits in a different place. But if you go with implants and you can get rid of all the plastic in the roof of your mouth, you're going to speak more clearly, and it's just a world of difference.
Now, you're a dentist, so
Yes.
you probably think that the smile is one of the most important things.
Absolutely.
How important is it, in your opinion?
You know, that's one of the first things that people notice is your smile. I mean, it warms your personality. How many Hollywood types do you see out there with bad teeth? One of the first things that a lot of young actors and actresses do is get their teeth fixed, get veneers, get orthodontic treatment.
I had somebody from LA, you know, we're here in San Diego. They say the first thing the agent does is gets their teeth fixed. And you see that with American Idol. You know, they win American Idol, they had bad teeth, and then all of a sudden, a month later, they have great teeth.
Yes.
So the teeth is, and it adds to your sophistication. You know, people need to know it's a real interview, and I'm trying not to be on your side, but it sounds like that if you're missing teeth or if you have a loose-fitting denture, it sounds like a better option, right?
It is a better option. It's just I can't emphasize this
Is it
enough.
tough just to get them in, get these dentures to come in, get evaluated, and let them realize that maybe it doesn't hurt so much?
Yeah, I think it is because a lot of people have those bad experiences that they're drawing on, and we really want to at least have a chance to get them to come in and let us talk with them. There's no obligation. If you find that it's
So it's a
nothing,
free consultation.
I'd be happy to do a free consultation for anyone who's interested in implants.
Okay, good. And they'll meet with you face to face, because I know you have an associate. Is that right? Somebody else that works with you does a lot of the smaller things.
Yeah. Well, actually, he does implants too.
Okay.
So he will meet with either me or Dr. Roberts, and we can come up with a customized treatment plan and see if that's something that's right for you.
Now, we are out of time. Final message to a patient that is watching this, maybe their teeth need to be pulled out, or they're wearing a loose-fitting denture, but they're still skeptical. They're still afraid. What do you want them to know?
I want them to come in, meet us, talk with us. We'll come up with a treatment plan that's customized just for them, and there's no obligation. If they find that it's for them, that's great. But I'd be more than happy to have a chance to talk to them.
All right, thanks for coming on the show. Great stuff. Great information.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.